Welcome to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalata from Roots Community Health, reporting for the week of December 15th, 2025. As health professionals rooted in East Oakland, facing some of the widest health disparities in the nation, we're here to bring you timely public health information relevant to us all. This week's briefing focuses on three important topics. First, we will discuss the current status on contagious illnesses, including the sharp rise in measles cases across the United States and what that means for our communities. Next, we'll break down recent updates to the Affordable Care Act and how changes to health coverage could impact millions of people. And finally, we'll share practical tips for staying healthier during this holiday season when travel and gatherings can increase the spread of illness. First, let's take a look at the overall picture of what's circulating in our communities right now. Starting with the weekly percent positive chart for respiratory viruses in the United States, which tracks the proportion of tests conducted in clinical settings. We see that rhinovirus, enteroviruses, the viruses responsible for the common cold, shown in the gray line there, continues to make up the largest share of circulating viruses, though their share of positive tests appears to be declining. Meanwhile, influenza, represented by the dark blue line, is making up an increasing share and now ranks just behind the common cold in terms of weekly percent positives. These trends indicate that flu season is officially underway. And this is further confirmed when we look at influenza epidemic trends. As a reminder, these are forecasts based on primarily emergency department data to give us a current sense of community spread. And as we can see, the majority of the country is depicted in dark purple, meaning influenza is actively growing, or in lighter purple, meaning it's likely growing. As you can see, none of the states across the United States are declining. There are still a handful of states that are not reporting data for whatever reason. Those are shown in white, while only 2 are pictured in gray, indicating that they are stable. Now, taking a look at COVID epidemic trends, we can see growth shown in shades of purple dispersed across the country, with only 4 states listed as declining. Many states are pictured in gray, indicating that community activity is stable or not changing yet. I will note that when we reported last week, California was likely declining, but now we can see it is likely growing, so things are changing. Taking a look at hospitalization data, we can see that RSV in the purple line, as well as COVID in the orange, are trending up, but only very slightly at this time. But influenza hospital rates shown here in the blue line are clearly heading up and have surpassed COVID-19 hospitalizations. So yet another clear indicator that flu season is well underway, with severe outcomes already increasing. With flu season officially underway, we're once again launching our recurring Flu Watch segment, where we provide regular updates on the current status of the season. Flu season has been underway since late September, so week 40 out of the 52, and then now we're in week 1. So this is how the weeks are numbered. But already in just the past couple of months, there have already been approximately 1,200 deaths, sadly, including 1 pediatric death, which just occurred last week, and more than 30,000 hospitalizations. So already a high burden this flu season, and we are just heading up from here. These early numbers underscore the seriousness of influenza and highlight the importance of taking precautions to protect yourself, your loved ones, and your community. As flu activity continues to rise across the country, alongside ongoing circulation of COVID and other respiratory illnesses, another highly contagious disease is continuing to see concerning increases and certainly deserves our attention. The United States has continued to stack up measles cases. We are climbing nearer and nearer to 2,000 confirmed measles cases so far. This is already far exceeding the 195 cases recorded in all of 2024, about 10 times the number we had last year. This represents the highest numbers of measles cases that we have seen in this country since the disease was declared eliminated in the United States in 2000. Elimination is not permanent. Elimination status must be maintained, and we are on track to lose our elimination status if things continue the way that they are. So far this year, 88% of measles cases have been linked to outbreaks, with 47 outbreaks reported nationwide. This is a significant increase compared with last year, where we had 16 outbreaks. The continued rise in measles cases heading into the holiday season is especially concerning given how highly contagious the virus is. Large outbreaks are currently occurring in Utah, Arizona, and South Carolina, all of which have been discussed in previous briefings. Each of these states has now surpassed 100 reported cases. In South Carolina, 129 measles cases have been reported, with 126 of them linked to an ongoing outbreak in the upstate region. So this means there is local transmission. And the vast majority of cases have occurred in children, including 75 cases among children aged 5 to 17 years old, and 20 cases in children under 5. Only 10 cases have been reported in adults in this particular outbreak. So this one is significantly affecting our young people. 2 weekends ago, the South Carolina Department of Public Health confirmed more than 24 new cases, a surge that's likely connected to increased transmission over the Thanksgiving holiday. And of course, this is especially concerning as we are heading into the winter holiday season, when travel and large gatherings and time spent indoors can further accelerate the spread of measles within populations, especially within populations that are under-vaccinated. Many of the South Carolina cases were linked to exposure at the Way of Truth Church in Inman, South Carolina. And this is just one example of how contagious measles can be among a tight-knit community and within enclosed spaces. One infected person in a public setting can quickly expose dozens of other people, and when vaccination rates are low, the virus can spread quickly through a community. As a result, when the outbreak began in October, it took off, it took hold, and is now moving beyond the initial location. And unfortunately, it shows no signs of slowing. Despite significant efforts by South Carolina Department of Health, including the use of mobile vaccination sites to reach affected neighborhoods, vaccination uptake in the community remains low. Limited vaccine coverage continues to allow the virus to spread and makes controlling the outbreak much more challenging. At present, over 250 unvaccinated individuals, including students from 9 local elementary, middle, and high schools, are in quarantine. Because measles quarantine lasts 21 days, many of these students are missing weeks of in-person instruction, and some of them are now in quarantine for the second time since the outbreak began. This level of disruption highlights the critical importance of measles vaccination, not only to protect children from illness, but also to keep them in school and prevent repeated prolonged absences. The South Carolina outbreak has now become the 3rd major measles outbreak in the country this year. Another major outbreak is occurring along the Arizona and Utah border with a total of 254 cases so far. This is currently the 2nd largest outbreak in the United States this year, following an outbreak earlier in West Texas that involved more than 800 cases. In Utah, 115 measles cases have been reported, with 82 linked to the outbreak in Southwest Utah. Of these cases, 108 occurred in unvaccinated individuals. 7 occurred in vaccinated individuals. We know that no vaccine is 100%. There's going to be a few that do not mount immunity. And unfortunately, even though these individuals did get vaccinated, they were still infected. But again, this is the much smaller percentage of people becoming infected. Unlike South Carolina, a larger proportion of cases in Utah have occurred in adults, with 68 cases in individuals under 18 and 47 cases in those over 18. 12 of the Utah cases have resulted in hospitalization, and 26 residents have been diagnosed in just the past 3 weeks. Across the border in Arizona, 176 cases have been reported, with 172 occurring in Mojave County and linked to the outbreak. 6 hospitalizations have been reported. Similar to Utah, 66% of cases are in individuals under 18, and 97% of cases are among unvaccinated people. It's important to remember that if someone who is not vaccinated against measles gets exposed to measles, they almost always get infected. So they just do not have any protection. And so infection is almost a certainty. Measles is one of the most contagious viruses in the world. It can remain in the air for hours after an infected person leaves a room. Infected individuals are contagious for several days before symptoms appear, making it easy for the virus to spread widely before anyone even realizes that they're sick. Measles is not just a mild illness. It can lead to serious complications, including respiratory failure, inflammation of the brain, and even death. And in addition, infection with measles can wipe out a person's immunity to other diseases that they previously had antibodies from. So this leaves them more vulnerable to infections that they were previously protected against. Then there is also a rare but very severe and always fatal late complication that can happen years later with measles. Unfortunately, we are going to have to refamiliarize ourselves with that subacute sclerosing panencephalitis, which I have reviewed on previous briefings. There was a case earlier this year in Los Angeles, and this is absolutely not something that we want to have to familiarize ourselves with, but this is the direction that unfortunately we are heading as a country. To protect yourself, your loved ones, and your community, the most important step is to make sure that you are fully vaccinated against measles. The MMR vaccine, or measles, mumps, rubella vaccine, is safe, it's highly effective, it's been around for decades. We know that it provides long-lasting protection. Parents should confirm that their children are up to date on routine vaccinations, especially before travel, before gatherings or events where many people are in close contact. But just in general, we should be making sure that our children are protected. Also, if you are a daycare provider, a child care provider, it is worth ensuring that all of the children within your setting are fully vaccinated. During this time of year, it's especially important to remember that travel and holiday activities can accelerate the spread of anything that is transmitted by the respiratory route, including measles. Even one infected person on a plane or at a crowded gathering can expose dozens of others and spark a new outbreak somewhere else in the country. For that reason, anyone who develops symptoms such as fever, cough, runny nose, red eyes, or a rash should get medical attention, but stay home and contact a healthcare provider before you go around seeking care so that steps can be taken to prevent further spread, because we know that clinic reception areas and emergency departments can also be a place where more spread can occur. So if you suspect measles, make contact with someone before showing up. With cases continuing to rise, vaccination and early isolation remain the best tools that we have to stop measles outbreaks and protect vulnerable populations, including infants, older adults, people with weakened immune systems. Staying up to date on vaccinations is the most effective way to protect yourself, your family, your community, anytime, but particularly this holiday season and whenever you travel. Of course, protection is about more than just vaccination. It is also about access to care. Unfortunately, the healthcare safety net that millions of Americans rely on is currently facing serious challenges. Healthcare subsidies under the Affordable Care Act are once again at the center of a political standoff in Washington. These expanded tax credits, which help millions of Americans afford health insurance, are set to expire at the end of the year unless Congress acts. And unfortunately, partisan divisions over the subsidies previously contributed to the government shutdown, which ended with a promise from lawmakers to hold a vote on extending the benefits. Now, months later, that vote still has not been finalized, leaving millions of Americans to pay higher premiums as lawmakers continue to debate the issue. The open enrollment deadline for the ACA coverage ended on December 15th. And because Congress was unable to reach a deal to extend the subsidies, consumers who renewed or purchased coverage this year are already facing significantly higher costs beginning January 1. So this past Thursday, the Senate failed to advance competing proposals to address rising healthcare premiums. So both a Democratic-backed bill to extend subsidies for 3 more years and a Republican proposal to replace the subsidies with tax advantage health savings accounts failed to pass the Senate. So without action, premiums will continue to increase for Americans that are relying on ACA coverage. Now, expanded subsidies have provided a critical safety net for millions of Americans, significantly reducing the share of household income spent on health insurance premiums. So without these subsidies, people in the lowest income brackets will pay a significant percentage of their income for coverage. And higher earners could pay an even greater percentage. So no subsidies would be available for those earning more than 4 times the federal poverty level, which is $62,600 for an individual or $84,600 for a couple. So no subsidies would be available whatsoever. More than 24 million Americans rely on the Affordable Care Act for coverage. And while we know the system is not perfect, it provides essential protection and access to care for millions who might otherwise go without insurance. And we know that health care bills are the leading cause of bankruptcy in the United States as it is. So this is something that only stands to get worse. And losing these subsidies is more than just a financial burden. Insurers are already raising premiums, meaning that Americans are now paying higher costs because Congress has been unable to reach a deal. So for many families, this could mean delaying care, skipping preventative healthcare maintenance, including vaccinations, avoiding routine health visits. So subsidies are set to expire at the end of the month. Attempts to extend or replace them have failed, and there is no resolution in sight. So without a last-minute compromise, we can expect steep increases in healthcare costs for millions of Affordable Care Act enrollees. And these changes are on top of already concerning changes that are coming to Medicaid, new federal rules set to begin in 2027 under what has been dubbed as the One Beautiful Bill, or HR 1, will require millions of adults to prove that they are working or volunteering or attending school for at least 80 hours per month in order for them to maintain coverage. The law also restricts state financing and imposes stricter income verification for the Affordable Care Act subsidies. So combined with the loss of enhanced Affordable Care Act subsidies, all of these changes are further weakening the healthcare safety net for many, many populations, including our most vulnerable populations. The erosion of coverage comes at a critical moment for public health. Measles cases are rising across the country. We are on track to lose elimination status. Removing key protections makes millions more Americans vulnerable to serious preventable diseases. Communities with reduced access to care are more likely to experience outbreaks of measles and potentially other diseases that have been eliminated in the United States. So stay tuned for polio and other things that we thought were behind us. We are now at risk of these things making a serious comeback. The current situation highlights a broader trend of moving backwards in our healthcare system, moving away from healthy communities, undermining protections that help keep our communities safe and healthy. So we've shared a lot of concerning information about rising measles cases, increasing flu activity, changes to healthcare coverage. The holiday season is a time when infectious disease spread especially easily. As people travel more, they gather indoors more, they spend extended time with family and friends from different parts of the country or even parts of the world. While these risks are real, they do not mean that you need to avoid the holidays altogether. Following some simple precautions can make a meaningful difference in protecting yourself and those around you, including children, older adults, and people with weakened immune systems. So starting with vaccination, make sure you and your family are up to date on routine vaccines, including measles, flu, and COVID. Vaccination remains the most effective way to prevent severe illness and prevent the spread of infectious diseases. And take extra care when traveling and time out your precautions. So for instance, if you're going to be gathering with family in 10 days, then at Christmas time, then those 10 days you can be practicing extra caution, wearing a mask when you're going to meetings or you're in crowded environments. And in particular, take extra care when you are traveling, airports, planes, buses, trains, bringing people from many different places in close contact with another, and then onward onto their destinations. This is all a recipe for quite a bit of onward spread. Wearing a well-fitting filtration mask like an N95 or KN95 in crowded indoor settings can reduce your risk of exposure and then transmitting it on to someone else. If you're not feeling well, delay travel if you can to avoid spreading illness to others. And if you're not feeling well and you absolutely cannot avoid going around others, this is when it's especially important to wear that well-fitted filtration mask so that you can prevent spreading what you have to others. Be mindful during your gatherings. When the weather allows, gathering outdoors is one of the safest options. If you are indoors, focus on good ventilation by opening windows and doors, especially across the room from each other whenever possible. Using an air filtration unit or portable air purifier can help reduce the amount of virus in the air, especially during larger or longer gatherings. If available, monitor your indoor quality. You can use a CO2 monitor and assess your levels, and that can give you a sense of how well your space is ventilated. And testing before gatherings, especially if you've recently traveled or been exposed to anyone who's sick, can help to identify infections early. If you test positive, then stay at home. If you develop symptoms, then stay at home. Isolate, avoid gatherings until you are no longer contagious. So, and this is symptoms like coughing, a sore throat. Don't just say, oh, it's probably allergies. Test and isolate until you feel better and are no longer contagious. Staying home when sick protects everyone, especially infants, older adults, and people with weakened immune systems. So think about who it is you are going to go visit as well and do it for them. And finally, give yourself permission to adjust plans. Healthier holidays are not about perfection, but about reducing risk where you can. All of these layers add up and they allow you to celebrate while helping keep your family and community safer this season. So we've covered the rising tide of respiratory illnesses and measles and the critical need to protect the healthcare safety net that serves our most vulnerable. All of these topics point to the same truth. Public health is a shared responsibility. The choices we make now to get vaccinated, to mask up in crowded spaces, and to advocate for our community's access to care are not just personal decisions. They are acts of solidarity that protect the health of us all. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.